So topic of discussion for this lecture is we are going to discuss about what crescentic or rapidly progressive glomerulonephritis, that is our RPGN, right? Rapidly progressive glomerulonephritis. Now the way that we will proceed is initially what we'll do. Okay, this is the content of our first aid. We'll go on this content. At last we'll be discussing about all these things initially, right? We'll be discussing about all these things, and after completing all these things, what we'll do is we'll just correlate whatever we have studied right here with the content of our Robbins. Okay, and about this we'll also discuss these diagrams. So without delay, let's begin with our discussion now here. Okay, now if you have already watched the video on our acute one, okay, now if you have already watched this lecture, okay, this acute proliferative, right, acute proliferative glomerulonephritis, then it will be more easier for you. Okay, now after this, if this acute proliferative glomerulonephritis, if it will persist, or if it will be worsening, then at that time there will be the result of our crescentic or rapidly progressive glomerulonephritis. Okay, now what will happen in this condition? Okay, what will happen? Why this rapidly progressive glomerulonephritis is also called crescentic glomerulonephritis? Because there will be the formation of what crescentic shaped structure, right? In our glomerulus, there will be the formation of crescentic shaped structure. Okay, now what I would like to do is, now initially, okay, suppose this is what this is. What is going on here? Okay, let me make, what is this? Okay, this is our glomerulus, right? What will happen is, okay, as you can see, this is our basement membrane. What will happen here is there will be damage in our basement membrane. That means there will be damage right here. There will be damage in our basement membrane. Okay, let me complete it. It is like this and it is like this. Okay, what is going on? There is damage in our basement membrane. As there will be damage in our basement membrane, right, as there will be damage in our basement membrane, what will happen is, okay, as there is damage in our basement membrane, what will happen? There will be leakage of inflammatory cells. Okay, there will be infiltration of inflammatory cells. This is our glomerulus. What is going on here? There is inflammation, right? What we are talking about? We are talking about glomerulonephritis. What is this? Itis. It is inflammation. There is inflammation in our this glomerulus, right? Glomerulus. Okay, as there is inflammation in our glomerulus, right? Okay, and there is, what is going on here? There is also inflammation in our this basement membrane. As there is inflammation in our basement membrane, there will be leakage within it. As there will be leakage within it, what will happen? The inflammatory cells, they were present, right, which were present in our glomerulus, now they will leak, right? They will leak now. And now as they leak right out of our this basement membrane, what will happen is, as we know that our these, right, these, what are these? These is our parietal cells, right? There are parietal cells. Now as these inflammatory cells will, it will just leak. What these inflammatory cell will do is, these inflammatory cells will they will cause excessive multiplication of our these parietal cells, right? As there will be excessive multiplication of our parietal cells, right, as there will be excessive multiplication of our these parietal cells, what will happen is that this will cause these will increase in size, and this will this will cause shrinkage of this this glomerulus, right? It will cause shrinkage of our glomerulus. Now the glomerulus will be shrinked, right? It will be shrinked. Now as this glomerulus will be shrinked, what will happen? Obviously there will be reduction in glomerular filtration rate. What will happen? There will be reduction in glomerular filtration rate. Okay, that means, okay, what we are talking right now, we said that what is going on here is, what is happening? There is inflammation in our basement membrane, there is leakage of basement membrane, but these will cause infiltration of inflammatory cells to our these parietal cells. This parietal cell will proliferate, and what will happen? There will be lesser space, right? There will be lesser space, or there will be compression of glomerular, that will cause decreasing in glomerular filtration rate. Okay, now the important thing that I would like to take you toward is, right, since there was onset of, because of these things, right, there is decrease in glomerular filtration rate, right? Now as there will be the onset of sign and symptom, if this onset of sign and symptom will persist for several months, right, and this will continue, right, this process will continue, then what will happen? There are the chances of what? There are the chances of renal failure also. Okay. Renal failure also. And as there will be renal failure, right, as there will be, okay, if there will be there is onset of sign and symptom, and if this persists for a month, there can be the condition of renal failure also. Okay, and this renal function, what will happen? There will be what? There will be there will be unfunctioning of our kidney, right, and this may cause what? This may cause what? Death of patient so rapidly. So it is a dangerous situation. Now, talking about its pathogenesis, right, talking about its pathogenesis, the thing that we need to know is, okay, we talked about what? Severe glomerular inflammation. Yes, we talked about this thing. This will cause what? This will cause the leakage of what? This will cause the leakage of inflammatory cells, I said, right. Now, in that inflammatory cells, let's see what there is also what? There is also thrombin, right. Now, what is this thrombin? What is the importance of thrombin? This thrombin converts what? Fibrinogen into what? Into fibrin, right, fibrinogen into fibrin. Okay, now as there will be the leakage of thrombin, right, there will be also the leakage of fibrinogen. Now this thrombin will convert this fibrinogen into what? Fibrin, right. Okay, then we can say that there is the deposition of what? Fibrin. Okay, that means there will be deposition of what? Fibrins, right, fibrins. There will be WBC infiltration. Yes, we know, right, there will be what? Inflammatory cells are what? Our WBC infiltrations also. Now, as we have said that there will be what? Parietal cells, what there will be what? Proliferation of our parietal cells. So these, what are these structures doing? These structures are helping in formation of what? Crescent formation, right. These are creating crescent formation. Okay, now as you can see, as there will be increase in our these parietal cells, there will be increase in our inflammatory inflammatory cells. What will happen is there will be this type of shape. Okay, there will be glomerule right here. Okay, and this half moon like shape, it is called what? It is our what? Crescentic formation, right, crescent formation. This is our crescent formation. Okay, now moving further, okay, now these rapidly proliferative glomerulonephritis, it consists of several what? It consists of several types. Now, before getting into types, okay, I would like to make you clear again about what? Our what? Crescent formation. Okay, what is going on is, this is our what? This is our normal glomerular. Okay, this is our what? This is our normal glomerular, right, this is our normal glomerular. But what will happen in the case of what? What will happen in the case of our this RPGN? What will happen is the parietal cells, right, these parietal cells, what will happen? They will just proliferate, right. This parietal cell will proliferate. As they will proliferate, what will happen? Now these what are these? These are our what? Glomerular. Now these glomerular, they will just what? They will just be in the shape of our what? Crescent shape. So this is what? This is our crescent formation, right, crescent formation. Yes, we're talking about the types, right, talking about the types. Okay, these are what? These are of what? These are of our three types: type 1, type 2, and type 3. And these types are actually, how are these divided into several types? These are divided into several types on the basis of what? On the basis of deposition of different substance within what? Within the layer of our what? Our this glomerular. Okay, now talking about what? Okay, talking about its type, our type, it is our the first is our type 1. Now it is, now here what will happen in this type 1 is, right, there will be antibody against glomerular basement membrane. What will happen? There will be, right, there will be antibody, right, antibody. Okay, there is what? Initially what will be happening? There will be antigen. Now these antigen will what? It will help in production of antibody within our body, and this antibody which is produced, it should be what? It should be what? It should be against glomerular basement membrane, right. Now as there will be what? There will be antibody against glomerular basement membrane. Obviously there will be what? There will be the similar condition of what? Inflammation in glomeruli, right. Okay, so the type 1, there will be what? There will be the formation of what? There will be the formation of antibody against glomerular basement membrane. So it is called anti-glomerular basement membrane disease, right. Okay, now one good example of this type 1, right, type 1, or what our anti-glomerular glomerular basement membrane disease is our Goodpasture syndrome. Now about this we'll be learning in another lecture in detail. So it is the one example of our anti-GBM disease. Now here, now of each type, of type 1, type 2 and type 3, the thing that we'll do is we will be looking toward the immunofluorescence finding, right? Immunofluorescence finding and the way of treatment, right? We'll just focus on that thing. Okay, now here talking about the immunofluorescence finding of our this type 1, right? It is linear immunofluorescence. Okay, this is our what? This is our linear immunofluorescence, right? There will be linear, right? These will be linearly arranged. Now this linear immunofluorescence finding, this will be found in the case of our type 1 anti-GBM disease. Okay, now what we will do is, for the treatment of this condition, what we will do is we will do plasmapheresis. Now what is this plasmapheresis? What we'll just centrifuge our blood, and after centrifuging our blood, what we'll do? The thing that we'll do is we'll do filtration of plasma, right? We'll do filtration of plasma. Now here, okay, here this is possible, right? Okay, now here plasmapheresis is possible because here the causative agent, right? The causative agent that is causing our this type 1 disease is our something virus or other our other entities, right? So there is the presence of there is the presence of our pathogen. So right, so we are able to do this plasmapheresis. Now talking about type 2 condition, the type 2 condition is the condition, right, in which there will be immune complex deposition. Now as we have said that the plasmapheresis was the possible treatment procedure for our type 1st, because there was presence of antibody. But here this while treating this type 2, the plasmapheresis will not help. It will not help because here we need to treat the primary cause, right? The primary cause which is which is causing manifestation of type 2 condition. Okay, the important example of this type 2 are our SLE, our IgA nephropathy and IgA nephropathy, right? IgA nephropathy, we will be talking about this IgA nephropathy in the condition of Buerger's disease, and similarly we have HSP. Okay, now yes, now talking about the immunofluorescence finding of this type 2, we have granular immunofluorescence, right? There will be granular. Why it is granular? Because of the deposition of IgA, IgG, right? In the case of in our subepithelial in deposition, right? Okay, now these are granular immunofluorescence finding. It happens in the type 2 condition, right? Okay, type 2, as we have already discussed, the treatment will be done by treating the primary cause of the disease. Now talking about the type 3, right? Type 3 is our Pauci immune rapidly proliferating glomerulonephritis. Now what is this Pauci? Pauci means few or none. That means here there will be no glomerular basement membrane antibody. There will be no glomerular basement membrane and antibody. Pauci means few or no. So there is no any antibody right here. That means there will be there will be no immune complex also. We are talking about we are talking about glomerular basement membrane and antibody in the case of type 1, right? Now similarly we are talking about immune complex in the case of type 2, but here nothing is being found. Here the thing that will be responsible to cause it is our ANCA. What is this our ANCA? What is this our ANCA? This ANCA positive means what? This is our anti-neutrophilic cytoplasmic antibody, right? Anti-neutrophilic cytoplasmic antibody. Now one function of this ANCA. Okay, now one thing that in one condition we discussed about ANCA in detail, and that was that was in vasculitis condition, right? Now there are two type of ANCA. The one is our C ANCA and one is our P ANCA, right? C ANCA positive, right? C ANCA positive is found in the case of Wegener's granulomatosis, right? Wegener's granulomatosis. Now talking about P ANCA, it is found in polyarteritis, microscopic polyarteritis. So this was about this was about different types. Now okay, now talking about again recalling all different types. What we said is type 1. What is type 1? It is glomerular basement membrane associated, there will be antibody against glomerular basement membrane, right? One good example is our Goodpasture syndrome. Now similarly, now in talking about type 2, what will be there? It is also called immune. Here the there will be what? There will be immune complex deposition, right? And the good example are our what? PSGN. What is this PSGN? Post streptococcal glomerulonephritis, that we discussed earlier in our lecture. And another is our SLE, similar, talking about type 3, that is our Pauci immune, right? What is this Pauci immune? That means no immune complexes, no antibody. And the good example are our Wegener granulomatosis, our microscopic polyangiitis, right? And this Wegener's granulomatosis, here there was what? There was positivity of C ANCA, whereas in our this microscopic polyangiitis there was positivity of our what? P ANCA. Now here, okay, talking about microscopic, right? Now light microscopy study shows the light microscopic shows that more than 50% of glomeruli will show crescent, right? Crescent, we discussed about crescent already, right? Okay. Now this crescent, how it was formed? It was formed by the proliferation of parietal epithelial cells. Yes, we know it was formed by deposition of fibrin leukocytes, right? Okay, now another thing that is mentioned right here is, as there will be the larger number of crescent, there will be the poorer prognosis. Yes, right, there will be poorer prognosis. You can see in this diagram, what is this? This is our crescent formation. As you can see, what is this? This is half moon like appearance, crescent formation. Why this is happening? This is happening because of what? Because of proliferation of our parietal cells, deposition of our fibrins, right? Fibrins and various leukocyte WBC, what? WBCs. Okay, now here you can see compressed what? Glomeruli, compressed glomeruli. So this is our crescent formation. Okay, now we discuss about these things. Now let's go toward what? Toward the content of our first step. Now rapidly progressive, or it is also called crescentic glomerulonephritis, right? And it is poorer prognosis. It is poorer prognosis because it is progressing so rapidly, right? It is progressing so rapidly. And what will happen here? There will be rapidly deteriorating renal function, right? This will happen from day to weeks. Now as renal function will be deteriorated so excessively, there can be the death of patient also. Now here light microscopic shows crescent moon shape structure. Okay, now what does this crescent consist? This crescent consists of fibrin. Yes, we discussed plasma proteins, example C3b. Yes, there can be the deposition of our what? Plasma proteins, complements C3b also, right? Now there will be what? Proliferation of parietal cells, monocytes will be found there, macrophages will be found there. Now several disease processes may result in pattern which may be delineated via what? Immunofluorescence pattern. That means here what is saying that on the basis of immunofluorescence pattern, there can be the division of several types. Okay, now linear immunofluorescence. Yes, we know about linear immunofluorescence. What was found in where the linear immunofluorescence was found? It was found in type 1 type, right? Type 1. Yes, similarly what? Negative or Pauci immune, it was found in type 3, if you remember, type 3. Similarly what? Granular was found in type 2, right? Okay, now talking about what? Talking about linear immunofluorescence, right? Immunofluorescence due to what? It will be happen due to what? Antibodies will be formed against glomerular basement membrane, right? And it is also saying about alveolar basement membrane. And this one example, good example is our Goodpasture syndrome. So important. Goodpasture syndrome, clinical manifestation will be hematuria. There will be the presence of RPC in our what? Urine. There will be hemoptysis, right? Vomiting. Similarly, here this is associated with what? It is associated with our type 2 hypersensitivity reaction. How we are going to treat it? We are going to treat it with the help of plasmapheresis. Talking about what? Let's talk about initially about granular immunofluorescence 1. It is type 2 one. It is found in the case of what? It is found in the case of our post streptococcal glomerulonephritis, right? Or diffuse progressive glomerulonephritis. And here what will happen? There will be the formation of immune complexes. That's all. Now talking about negative or Pauci immune, right? There will be no IgG or C3 deposition. Now it will be found in granulomatosis with polyangiitis, right? It is also found in Church-Strauss syndrome, right? Here the things that are associated are P, R3 ANCA and C ANCA. Now here what will happen, there will be eosinophilic granulomatosis. Okay, yes, we already talked about this eosinophilic granulomatosis with polyangiitis. Yes, we talked about these things. There will be what, or microscopic polyangiitis. Yes, we talked about this thing. Okay, and this is associated with our P ANCA. Okay, now this was about what, this was about the content of our first aid. Now moving toward what, moving toward our Robbins. What we'll find here is, okay, what we'll find here is, okay, here the initially we'll find definition about what is RPGN, right? It is a clinical syndrome associated with severe glomerular injury, but it does not denote a specific etiology. Yes, there are several etiological condition. Yes, we have mentioned about this thing. Now here it is written, it is mentioned about what, crescentic glomerulonephritis. Yes, it is same thing. There will be what, crescent in most of the glomeruli in more than 50% of the cases. And now after this, what is going on, talking about pathogenesis, right? Okay, talking about pathogenesis, there was division into what, 3 groups, right? Into 3 groups. You can see one is what, GBM antibody mediated disease, right? We talked about what, linear deposit right here. We talked about renal failure, Godpastor syndrome, treatment plasmapheresis. Similarly, another type 2, it is what, it is caused by immune complex deposition. Here we talked about what, granular deposition, right? And we talked about HSS, right, Hannon's Sclerosis purpura. We talked about what, IgA nephropathy. These were the examples of this, right? And okay, now we said that it cannot be what, helped by plasmapheresis, it can be treated by plasmapheresis. And what we said, in order to treat it, the treatment for underlying disease should be done. Now another one, the type 3, we said that Pauci immune crescentic glomerulonephritis, there will be the lack of detectable anti-GBM antibody or immune complexes, right? Yes, we talked about these things. There will be no deposition, right? There will be what, there will be no, in type 1 there was linear, type 2 there was granular, but in type 3, because of lack of antibody, there was no deposition. Okay, yes, we talked about, yes, we discussed about these things, type 1, type 2, type 3. Here these are the examples, right? Yes, we talked about what, this crescentic formation. You can see the glomeruli is right here inside, and you can see what, this is crescentic shape. You can see proliferation of our parietal cells, infiltration of our WBCs, right? We can see these things. So this was what, crescentic glomerulonephritis was, which was stained with periodic acid scaff stain. Okay, and yes, we talked about P ANCA. Yes, we talked about these things also. What we talked about, what, now this in Pauci, right, in Pauci immune, in our this Pauci immune type, we talked about P ANCA, we talked about C ANCA. We also said that these are related with vasculitis also. Okay, we talked about this Wegener's granulomatosis was associated with C ANCA, right? Okay, now these were the things that we discussed. So if we go thoroughly, I think we will have something idea about our this rapidly progressive glomerulonephritis. So with it, I'd like to end our lecture right here. Thank you and have a great time.